We're going to get started. To start with the Ontario numbers, today the numbers went up by 904, and we've had, I think, 3 days in a row the numbers have gone up in the 900 range, which is refreshing compared to what we used to have back in December. 4,000 cases. Again, most of them are driven by Toronto, and it seems that our area is stabilizing. For all intents and purposes, all of the numbers seem to be going down. Hospitalizations, outbreaks, going down across the province. One of the things that we're seeing is the VOCs, which are the variants of concern. To date, they've been 320 in the province, and most have been the UK version. And again, this is where we're seeing clusters of cases, and this is worrying us a bit. And I'll talk a bit about that later. In terms of our local numbers. Us too, it's reflective of a downward trend. We now are at 117 active cases, and over the weekend we we added 20 total, 4 in Cornwall, 10 in SDNG, and 6 in Prescott-Russell. That's over 2 days. Again, it's much better than we used to do. We used to have over the weekend 70, 80, sometimes 130 cases added. So this is a good improvement. Obviously, if we're looking at the rolling averages, we're really going into clearly into the orange zone at this point in time, we're just holding there steady. I know that we're approaching yellow, but at this point, we're just going to move forward. That's going to get reevaluated next week. I'll be honest with you, I'm not that anxious to change. There's going to be some revisiting of these frameworks based on perhaps that variant of concern that I was talking to you about. And so at this point, we just started today, orange, and that means that the stay-at-home order has been removed. Again, I stress the importance of staying at home as much as you can, and ensuring distancing and masking. That's very important, particularly when we're looking at some of the outbreaks that we're seeing. The cases multiply very quickly with this new variants that we've seen clusters in several cities in Ontario at this present time. In terms of our hospitalizations, actually we have 1 in the ICU and 16 in hospital. Most are in Cornwall. There's 6 at the Ottawa Hospital and 1 at the Hawkesbury General Hospital. 1 ICU is in Cornwall, and it's at the point where. Again, looking at these numbers here, looking at our numbers, our outbreaks have gone down, our hospitalizations have gone down. We have 1 extra death that was added. This is a patient that was palliative, that was from the long-term care home in Lancaster, died in hospital. And so that's another tragedy again. But if we're, like I said, moving at all these directions, we're seeming to be in the right track. Or our numbers are getting low in terms of active cases throughout our area, and so it's just that's a good sign. Again, we should not be complacent moving forward. Now, in terms of the long-term care homes, we have, like I said, 13 in outbreak. Several have been declared over. The Lancaster home was declared over actually on the 12th. The home in Akwesasne was declared over, as was the Glenstore Dunn Lodge as well, as was Pinecrest that was declared over. Place Rideau was declared over, and the retirement home in Akwesasne was over as well. We added several. Most of them that we've added were staff over the weekend, and at this point, the only one that we have active cases is the Riverview Manor. We still have 1 active among the 19 positive residents and 1 active among the 8 positive staff. And so again, we're supporting the homes, and again, it seems that those numbers are going down. Woodland Villa is still active at this point. Just to recapitulate, 40 positive cases, 13 of which are active. There've been 5 deaths there and 14 positive staff, with 6 active at that point, again, support the usual IPAC support and so on. And moving into our schools, we we now have 5 cases in 4 schools, no outbreaks at this point in time, and really, we're just like I said, trying to ensure that the numbers stay down in our area. Speaking of which, what's going to help go the numbers down is our vaccines, and we've now on our website we've got 3,300. I just wanted to clarify a few things because I've got some questions from the media and questioning, the numbers and because I keep saying about 1,100 doses. The reason I'm saying about 1,100 doses is as follows, and I want people to understand this, particularly the media that have chosen to look at these numbers carefully. There's each tray of Pfizer vaccine, and to date we've only received 3 trays, has 195 vials. Each vial had 5 dosages, and that was 975. Now they're delivering to us saying you can get 6 out of them. So 6 doses means there's 1,170. The problem is that initially, when we were starting to work with the vaccine, we were with our nurses and everybody was not used to drying it, and they were drying out only about 6 doses and half the vials. And so now with a 1 cc syringe, and we're also using a bigger syringe now with a special called low dead volume syringe, 1 cc syringe, we're able to get 6 doses in about 80% of the vials. So we're closer to 1,100. That's why I'm saying about 1,100. It's because, like I said, and our actual numbers are posted on our website. They also include 200 doses that we got for Moderna as well, that in that as well. So and Aquasosny's numbers. So again, that's why I'm sometimes I say about. It's not because we're trying to hide things. It's because again, it depends on how many dosages we can get out of that. So I just wanted to clarify that. So we're proceeding despite the weather today. We proceeded to vaccinate 2 more retirement homes, and we're proceeding now to go back to our long-term care facilities. There's been a bit of a change in our priority. We now have our immediate first dose vaccination priority is staff and essential care workers and long-term care and retirement homes, and we've done that. We're well on our way. Also, alternative care patients in hospital who are waiting to go to long-term care, that's underway as well. And we're continuing now with the highest priority healthcare workers. Essentially, those are front-facing healthcare workers, ICU, emergency room, those type of things that are seeing patients, and obviously continuing the Indigenous adults in Aquasosny for Aquasosny. Now, the next priority dose, which will probably occur imminently, depending on the vaccine supply, is the general said by March 1st, but we could do it a bit earlier. Once we've really done the retirement homes, the long-term care homes, first dose of everyone, including staff and so on, we will then concentrate on 80-year-olds and older. That to me it's very important. Continue with our staff and retirement homes and so on. Healthcare workers at high priority level, which is a lower level. In accordance, we have a prioritization framework, and as well as start vaccinating adults in chronic care at their homes. Our directive again is that for all residents of long-term care and retirement homes and people over 80, for the Pfizer vaccine, they will get their vaccine within 21 and 27 days. For everybody else, it can go up to 35 to 42 days, the intervals. Moderna stays the same at 28 days. So happy to report that we've had real success moving forward again in terms of vaccinating with what we had. This week, we are supposed to receive, we were supposed to have received it today or tomorrow, but the weather has slowed it down. We're supposed to get 3 trays of Pfizer vaccine, which again can have up to 1,170 each. So I'm rounding it off to about 3,300. Next week, we're supposed to get four trays, and the following week we're supposed to get 3 trays as well. And after that, we'll be getting a percentage allocation based on our population. We were told by the general today that we're likely going to get vaccines in the millions monthly from Pfizer starting in middle March into April. So we will have plenty of vaccine moving forward. We're now creating our plans to have multiple clinics, multiple sites, and we will be communicating those on a regular basis. At this point, we are focusing on these and planning our next swath of populations, which will include essential workers, younger age groups, younger than 80, going 70, 65, and so on, and individuals who have chronic medical conditions. And eventually, at one point, it's all going to sort of bloom into, because we're going to get imminent approval of Astra, and we're going to have even more vaccines available to us. So I'm going to take some questions now. I've got a couple here that I've sent here, but I think I've answered them. The one question here talks about how confident are we about the promised vaccine supply. Well, we got confirmation today that we will be getting it, so I am confident that we're getting that. I don't know beyond March 1st, but I do know over the next 3 weeks what we'll be getting, and it seems that we'll be getting over 10,000, way over 10,000 doses, which is very good. The other question is the freezer still in Hawkesbury? Yes, it is, and we've ordered another Pfizer freezer for Cornwall as well. That's easier to have it around. Please note that we also have a Moderna vaccine in Cornwall, and vaccine fridge. I mean a freezer, because that needs -20. But the AstraZeneca and the other vaccines that are probably going to come out very shortly require just regular refrigeration, like we have for our vaccines in general. And I answered the question about frontline workers in hospitals. They're already starting to receive. They've already started receiving. They're receiving moving forward as well. So, take some questions, Chantal.
Yes, our first question is from Philip Blanchard, the leader. Go ahead and unmute yourself, Philip.
Good afternoon, Dr. Paul. My first question, the 7-day rolling average places the EOHU actually in the yellow based on the numbers there. You're not so willing to go into it. Can you maybe expand a little bit more about why you don't really want to go into that? Because, I mean, usually that's a pretty quick decision, or has been in the past.
I'll tell you why, because we didn't have the variants of concern. Philip, we over the weekend, I spoke to some of my colleagues, and they described to me how quickly it spread and how quickly, like in an apartment building and condos, it spread tremendously. So I'm quite concerned about that. And so just as being cautious, we had actually suggested that we relook at the framework to begin with, saying that, okay, to be yellow, you have to have even lower numbers, so like pushing everything a bit to be a bit more strict. So that's why it's not to say that we're not going to go in yellow in a week or two. It's just that at this point in time, I would be very cautious about it. And I know that we requested to relook at the framework and say, okay, perhaps you can have orange restrictions and yellow and so on. So that's why. But in the past, I was less concerned about going to yellow and opening up even more to more people, because we didn't have the variants. Now we have the variants of concern, and that's why.
Okay, great. Thank you. And the second question, vaccinations in retirement homes. The province issued its next round of guidance on the over 80 retirement homes, frontline healthcare workers, and that. Do you have any kind of timeline of when you're going to try to get the first doses into retirement homes, like finished up?
As soon as possible. We should be, if all goes well, probably by next week, we should be done. If not, like for sure, the end of this month. And if all goes well and weather permitting, we should be doing it by the end of this month for sure. Have all those first doses done. And as a matter of fact, probably have finished the long-term care second dose as well by that time. We have enough vaccine now.
Okay, great. Thank you.
No problem.
Our next question is from Nicole from CBC. Nicole, go ahead and unmute yourself.
Hi, Dr. Paul. My apologies if this has been asked and answered in a previous briefing, but I'm wondering if you could elaborate a little bit more about the increase in opioid overdoses in Cornwall that you mentioned a few weeks ago. I guess, wondering if this is just Cornwall, or are we seeing similar trends in the rest of the region? And if it is just Cornwall, I'm wondering if you could be specific about statistics.
Unfortunately, I don't have. I presented the statistics last week. I don't have them off the top of my head. I put my sheet away. But I can tell you that it was a reflection of we take statistics from all four of our hospitals, and it's cumulative. The numbers that we have, so we're seeing it across the area, most markedly in Hawkesbury and Cornwall, mostly, and I can tell you that just off the top of my head, in just for comparison, in 2020 we had in 2019, sorry, there were less than I think 39 total admission visits to hospital for opioids, and between January and August of 2020, there were 40, and by the end of the year there were about 80 total. So we had more than double the total of the previous year across our hospitals, predominantly, like I said, mostly in the Hawkesbury and Cornwall hospitals.
I'm wondering why you think this might be the case, and is there anything that public health is doing or can do to prevent this?
One of the things that we've been seeing is that with the pandemic, there's been a struggle to get illegal supply into the area because of border closures and those type of things, and we've been seeing more and more laced, products that are laced with all kinds of other ingredients, including benzodiazepam that is not reversible by naloxone, and that's why we've been getting in trouble. So we've been telling people the most important thing is awareness, and we've always been having the message of please don't use anything off the streets that hasn't come from a pharmacy or from a doctor's prescription to you, and it's more of an education point of view that Narcan will not work if it's laced with this other benzodiazepam, which is like a sleeping pill, like a sort of a Valium type, but it won't be reversed. So that's what we're having problems. So it's, to us, unfortunately, it's more education as much as we can, and warning individuals of the fact that we've already had laced, fentanyl and synthetic fentanyls and those type of things, but now we have this additional issue that Narcan and naloxone will not reverse.
Thank you. And if I wanted to get a hold of those specifics, could I just send
just send me an email? Yeah.
Okay. Thank you so much.
Our next question comes from Nelson Zandbergen from Nation Valley News. Go ahead, Nelson.
Oh, hi, Doctor.
Hi.
I was wondering about the downward trend in cases, not just here, but in the United States as well. The curve is remarkably similar, including in some places where they have not followed the type of protocols that we have followed. Would you say there's more to this virus, or we still have much to learn about this virus as much as we think we know?
Yeah, I agree. I don't know where they are. Is it temperature? Is it humidity? I don't know. There's a lot of other things that we're not sure about. But I'm not sure if the vaccine has an effect, but they've only vaccinated I think 15 million people in the States. So I don't think it's a big proportion. So I can't attribute it to that either. Is it warm weather? Is it southern populations? I'm not sure what the actual trend is, but yes, it is going down. And these viruses work that way. They go up and they go down. They go up and they go down, and we can't really predict them. And then this is a newer virus, so we can't even predict them. The prediction factor is even more difficult. Let's put it that way.
Right. I just had another question.
Yeah.
When will 80-year-olds and older people get the call to attend vaccination centers? Not necessarily in retirement homes, I mean, just people in the community who are 80 and over.
That's very important. As soon as we can. I can tell you that as soon as we can, we're planning for it right now. We're told, by the end of the month for sure. I'm trying to do it as soon as we can because we need to go and vaccinate them. But if I can get away with vaccinating them simultaneously, we will. We're working now to identify where they are, identify with municipalities how to get the message out to them. And I want people to know that if an individual is homebound and can't travel or can't go to their clinics, we'll go to them.
Thank you, Doctor.
No problem.
La prochaine question provient de Denis Babin, Radio-Canada. Allez-y, Denis.
Bonjour, Dr. Roumeliotis. Vous venez d'aborder la question à propos des indicateurs de santé publique là, qui sont favorables, là, faisant en sorte que l'on pourrait bientôt se retrouver dans la zone jaune. Expliquez-nous pourquoi il faut quand même demeurer vigilant, pourquoi vous n'êtes pas pressé de changer de couleur trop vite.
Merci, Denis. En effet, oui, si on voit les chiffres et les indications, on va vers le jaune. Il y a deux facteurs. Premièrement, on voudrait voir une tendance sur deux semaines pour être sûr qu'on rentre là. Mais deuxièmement, c'est parce que nous avons des variantes, en anglais, on appelle variants of concern, les variantes de mutation de virus. On a 3 sortes en Ontario, en effet. Et on a eu des flambées dans des maisons, dans les appartements, dans des condos à Peel et North Bay aussi. On voit un cas devient 30 vite, vite, vite. Ça se propage très vite. Donc, nous, on est en train de travailler avec le ministère pour dire peut-être on devrait avoir les mesures plus strictes pour changer les zones. Disons, d'avoir des restrictions un peu plus dans chaque zone. Donc, je n'ai pas hâte de sortir d'orange présentement, étant donné qu'on vient d'être là aujourd'hui. On a à peine qu'on ouvre Orange aujourd'hui, mais plutôt c'est parce que je suis très inquiété au niveau de la présence des variantes qu'on voit. Et je pense qu'à un moment donné, on les a à Ottawa. C'est juste le temps qu'on aurait ça ici. Donc, c'est pour ça que je veux être très vigilante et très prudent. Et de façon provinciale, nous avons recommandé même de revoir les couleurs et les ondes, les indicateurs de chaque pour les mettre un peu plus stricts, même dans le jaune et orange.
Et à l'heure actuelle, vous êtes en mesure de confirmer qu'il n'y a aucun nouveau variant qui a été détecté dans la région encore? Là?
Pour le moment, on n'a aucune confirmation qu'on a détectée, mais je pense que à un moment donné, peut-être on va le trouver parce que c'est ça qu'on voit dans les autres pays. Ça commence, et puis après ça, on le voit partout.
Merci beaucoup.
Pas de problème.
Those were all the questions from the chat box. Do those joining us by phone have any questions? You can use *6 to unmute yourself. Ceux qui se joignent à nous par téléphone peuvent désactiver le mode silencieux en appuyant les touches, mon Dieu, en appuyant étoile 6.
Bill Kingston from Cornwall News Watch. Can you hear me okay, Dr. Paul?
Yeah, Bill, I can hear you.
Yes, I just wanted to ask you, you went to great length to talk about the doses in vials and the number of doses being drawn from vials, and you referenced a little bit about the media scrutinize on this. Can you expand a little bit about what your concerns are? Are there any allegations out there of people that are queue jumping for vaccines locally, or is there conspiracy theorists that are accusing you of putting vaccines to people that shouldn't be getting them?
No, not at all. It's just that I've had some questions by people saying you're not being specific when you're saying, when I say about 1,100. That's all it is.
Okay.
I just wanted to clarify it because I wanted people to understand that although we can, now they're telling us, like when we're receiving a tray, they're saying, yeah, you're receiving 1,170 doses. But it's not guaranteed that we're able to get them. We're probably successful at 80%, so it's about 1,100. So that's why I say about 1,100. I'm not trying to hide anything. I'm just saying the reality because you can't predict exactly what we can get out from each vial. That's why.
I see. And just as a follow-up, you said about 80% of going forward, about 80% of the draws from those vials are going to be 6 doses. Are you using exclusively those zero dead syringes now?
Yeah, now because before there was a shortage and we had to use 3 cc syringes, but now we have enough, and apparently the government has bought enough, it will ship them. But we've been using, when we use the 1 cc syringes and somebody's used to it, we're able to do it like most of the time, 80% of the time at least.
Okay, thank you very much.
No problem.
Any other questions from those on the phone? D'autres questions pour ceux qui se joignent par téléphone? I think that's all, Dr. Paul.
Thank you very much. Merci tout le monde.